its rarity. Although many diabetics do not feel safe participating in athletics, Diabetes Spectrum, a book from the American Diabetes Association, states, "Safe participation is possible for the large majority of athletes with diabetes. Most of these individuals have a strong drive to make the most of their abilities, and a properly devised management plan can be an important tool to help them reach their competitive performance goals." Establishing a management plan can be a challenge for families of diabetic athletes, but this can be addressed by providing proper education to each member of the diabetics care team, specifically coaches. Type 1 diabetes is defined by the National Federation of State High School Associations as an autoimmune disease in which the body's pancreas fails to produce insulin, the hormone that regulates blood glucose levels. The treatment for this condition is to give the patient insulin. However, there is no cure for type 1 diabetes. According to the American Journal of Lifestyle Medicine, more than 29 million people in the United States have diabetes, including both type 1 and type 2. However, only about 5% of those cases are type 1 diabetics. Although this number is increasing, the majority of people remain underinformed about how to manage the condition. A recent study conducted in September 2023 by Breakthrough T1D, a research organization that strives to develop extensive information about type 1 diabetes, surveyed type 1 diabetics and found that only 6% of respondents had known of sports coaches, PE teachers, and gym instructors to be educated about type 1 diabetes and physical activity. This low of a number shows the risk for diabetic participation in athletics and raises the question of, why are coaches not educated on type 1 diabetes? The information I found through my research suggests that coaches are not adequately educated due to the lack of standardized training requirements, a limited understanding of the complex management during exercise, and insufficient communication between the athlete's care team and the coach. Based on the information provided so far, there's a need to delve further into the legal aspects of this matter. Although there are currently no legal requirements for coaches to be educated on diabetes and what to do in the event of an emergency, diabetic students are covered by Section 504 and often have filed plans. Defined by the American Diabetes Association, Section 504 of the Rehabilitation Act of 1973 is a federal civil law that prohibits discrimination on the basis of disability. To be covered by Section 504, a student must have a physical or mental impairment that substantially limits the one or more major life activities, such as the functioning of major bodily systems. Section 504 applies to all schools that receive federal funding and mandates that staff members are trained in certain areas. These areas typically involve checking blood glucose levels and administering insulin and glucagon, recognizing high and low blood glucose levels and knowing what to do in an emergency, and other accommodations around the topic. Under Section 504, students can fully participate in all sports, extracurricular activities, and field trips, which may require that trained staff be available to supervise or provide diabetes care, but parental attendance cannot be required as a condition of participation. Section 504 establishes these guidelines for school staff, including coaches, yet most are still uneducated. This education should be promoted not only because of Section 504, but also for the sake of all type 1 diabetic athletes who wish to participate in athletics. The specific question I will answer throughout my research is, why should coaches be educated about type 1 diabetes and what do they need to know? This question is important to help raise awareness of the deficit in coaches' education on type 1 diabetes and will establish a procedure for educating our coaches at the Academy. Through my research, I have found sources to verify that teaching coaches about type 1 diabetes improves their knowledge, confidence, and abilities to support athletes with the condition. This leads to a better blood glucose management, increased participation in sports, and a reduced risk of the athlete feeling isolated or becoming inactive. This subject is important to me personally because I am a type 1 diabetic athlete. I was diagnosed at just 3 years old, and I've grown up teaching others about how my body works. I've been a dancer since I was 6 years old and started participating in both fall cheer and competitive cheer in high school. I managed my condition with an insulin pump and a Dexcom, which helped me maintain healthy levels each day. Throughout my life, I have both seen and heard of other diabetics who have voiced that they are too afraid to participate in sports that interest them. Most of these cases come from fears of being in an unsafe environment, especially when parents are not close by in case of an emergency. With my project, I hope to make sports a safer space for diabetics and raise awareness about the severity of this topic. At the beginning of my research, I was looking for sources that would provide basic context on my topic to verify its importance. The National Collegiate Athletic Association provided the perspective of being a student athlete with type 1 diabetes and the challenges that come with it. Certified mental performance consultant Carrie Cheadle says it is of paramount importance for coaches and athletic trainers to understand that athletes with uncomplicated type 1 diabetes are equally capable as athletes without diabetes. Certain accommodations for diabetes management need to be made so that the well-educated athlete and his or her support team can manage the diabetes in an effective manner, permitting performance at a high level. The disorder can also establish a lonely feeling in the people it affects, especially in children who are trying to keep up with school, athletics, and a social life. This feeling of being alone within the condition can be countered when the people in your life understand what you are going through and how they could help you. The NCAA uses these facts to provide a solution for how to support a type 1 diabetic athlete and to convey the importance of having a basic understanding of the condition, not only in case of an emergency, but also to provide emotional support and show that you care, which can help eliminate some aspects of loneliness. Throughout my initial search, I was given assurance that this was an important topic that had not been properly addressed. I continued to glean information on my topic and began looking into the legal side of this issue. A peer-reviewed journal written under the American Diabetes Association addresses the three main federal laws that protect children with type 1 diabetes. Section 504 of the Rehabilitation Act of 1973, the Individuals with Disabilities Education Act, and the Americans with Disabilities Act. These laws define diabetes as a disability, making it illegal to discriminate against children with type 1 diabetes. Legally, accommodations must be made for any school or facility that receives federal funding or is open to the public. Despite this, children in schools and athletics still face discrimination. Studies have shown that the majority of school personnel have an inadequate understanding of diabetes. Consequently, diabetes education must be targeted toward daycare providers, teachers, and other school personnel who interact with the child, including school nurses and coaches. This source from the American Diabetes Association gives insight to the gray area that comes with this topic of legality. After conducting most of my research, I reached out to our athletic director, Patrick Rainville, to inquire about the mandatory training requirements for our coaches. He sent me the website from the VPA that provides the training that coaches must complete to coach at St. Johnsbury Academy and under the Vermont Principals Association. There are 5 different trainings that coaches must complete in order to coach high school athletes. These trainings include coaches education, sport first aid, concussion education, CPR AED EAP training, and the NFHS implicit bias course. The Vermont Principals Association and the Vermont State Athletic Directors Association value the importance of a coach's education program. Therefore, these programs must be completed by each coach in a VPA member school from grades 9 through 12. This source is used by SGA to ensure our coaches get the proper education. However, there is no thorough training on diabetes throughout these courses. The NFHS First Aid Health and Safety Training has a section titled Diabetes, but it does not contain enough information to be a reliable source on how to manage your athlete's diabetes. All of this information further solidifies the importance of coaches' education for type 1 diabetic athletes. From my research, I have found that most coaches do not understand the importance of being educated on this topic, and few administrators are encouraging them to become educated. The American Journal of Lifestyle Medicine claims the key to proper management is taking a team approach. This includes involving the physician, the athlete, the parents, coaches, athletic trainers, and any other necessary school personnel. In hopes of combating this problem, my plan was to host an informational seminar for our academy coaches and fieldhouse staff. Along with the seminar, I also asked the athletic director to begin recommending that coaches have a one-on-one conversation with any type 1 diabetic who will be on their team. These conversations should happen at the beginning of the season and will target important topics for how the coach and athlete will work together to promote safety for a diabetic athlete. In order to make these one-on-one conversations easier for both coaches and athletes, I will provide both digital and physical toolkits to give coaches a better idea of what to ask in those meetings. Implementing these conversations will help the coach better understand each athlete and how they take care of themselves, as well as give the athlete a chance to ask for help from their coach if they need it. I held this seminar on November 17th with the hope of providing viewers with information on how to support a type 1 diabetic athlete throughout their entire season. I covered the general topics of what type 1 diabetes is, the importance of regulating blood glucose levels and what factors affect those levels, how type 1 diabetes is treated and managed, information about hypoglycemia and hyperglycemia, the effects of exercise on blood glucose levels, how to help a type 1 diabetic athlete in your care, and precautionary measures before, during, and after exercise. Through presenting this seminar, I got excellent feedback on how informative it was. Although I had hoped there would be more coaches there, I'm still happy with the outcome and how well the presentation went. I hope that this seminar marks the beginning of a change in how coaches are trained at SJA and potentially other athletic programs in the area. Due to the success of this seminar, I'm hoping it can become a common resource used to help promote the safety of all type 1 diabetic athletes. By implementing both the seminar and the one-on-one conversations, my hope is to make them a long-term outcome. I would like to make the seminar an annual presentation and the one-on-one conversations a natural part of welcoming a diabetic athlete to any team. To make this easier, I have discussed this with our athletic director and organized a system that will be easy to maintain. My goal is to make athletics a more welcoming and safe environment for all diabetics, so I will continue to work with people in order to make these plans last. Type 1 diabetes is a severe diagnosis that majorly affects how the body functions. Treatments help to manage the blood glucose levels. However, there is no cure and no definite way to know what each day will be like within the condition. Despite this, type 1 diabetics are perfectly capable of navigating through a busy schedule with work, school, athletics, and other aspects of daily life. For example, Mark Andrews, who plays football for the Baltimore Ravens, Jean Couturier, who played hockey for the Philadelphia Flyers, and Mason Miller, who plays baseball for the San Diego Padres, all have type 1 diabetes and are able to become well-established professional athletes. Type 1 diabetics should be able to feel comfortable in their sport, and coaches should be knowledgeable about the condition. If all coaches had some form of education on type 1 diabetes, athletics would be a safer experience overall. Thank you for taking the time to listen to my presentation today. Are there any questions?
In the toolkit you designed, what is one non-emergency accommodation a coach could easily make to help a type 1 diabetic athlete?
One easy accommodation that a coach could make would be allowing the type 1 diabetic athlete more frequent breaks and easy access to their phone during practices or games so that they can manage their blood glucose levels and treat if necessary.
You mentioned you had hoped for more coaches at your seminar. Roughly how many coaches did attend, and how will you ensure a better turnout next year?
There were only about 6 coaches at the seminar, but the plan for next year will be to implement the seminar presentation into one of the coaches' meetings that happens at the beginning of the year, or we'll have it 3 times a year at Meet the Coaches, because there's coaches' meetings before Meet the Coaches happens.
So Reagan, as kind of a follow-up, I've coached 4 different sports here, and had, several diabetic athletes. So I have a couple of questions. So as a teacher, we get in our grade book an identification of students on 504 plans and students who might have other issues, like who require EpiPens and whatnot. So I wondered if you talked to Coach Rainville about a way to indicate to the coaches which of the athletes who may be trying out for their sport might be diabetic? And then therefore, second part of the question, is there a course out there that you might suggest that we implement, or like the courses that we're required to take on NFHS? Is there one that we could take if we have a diabetic athlete? Thanks.
So to address the first part of your question, the one-on-one conversations at the beginning of the season will be it'll be discussed between the athletic director, the coach, and the diabetic athlete to just say, hey, this athlete has diabetes. Can you have a talk with them to make sure everything is going to work well for their season? And I haven't looked into specific courses that there are for diabetes education. However, the toolkits that will be provided to coaches will cover everything that you would need to know, like basic information in emergency situation care.
First of all, fantastic job. The presentation was really, really good. I loved your slides. The flow of it was excellent, so nice work. In any of the coaches that you talked to, because I've also coached here for 12 years now, I guess, and you taught me more than I've ever learned about diabetes just now. So did you get a sense that coaches knew anything about it, the ones that you've talked to before, like any other coaches? Yeah.
Most people don't know very much about it, especially I think people know more about type 2 diabetes than type 1 diabetes just because it's more common. But, yeah. Thank you.